wild ginger and milkweed. So wild ginger herbally, because I don't have a wild ginger for some reason is not homeopathically what do you want to call potentized and proven. So the uses for wild ginger is for tea, regulating blood sugar, infections, and gingivitis. So, and that's kind of what it wild ginger looks like. And I've seen that plant. I'm gonna go out and see, make sure I identify it right. That'd be nice to have some wild ginger. And milkweed. Milkweed is poisonous, so if you were gonna eat it, you would want to, boil it a couple times. But the medicinal use is an expectorant and purgative. So it pushes out fluids and all kinds of stuff, and it's an expectorant pushing out mucus. So let's see what's it say. He's got it in here. Asarum Canadense. Canadense. Asarum Canadense. So that's and it says tincture in all potencies, but it doesn't have very much. It hasn't been homeopathic. Now I wonder if regular ginger. I don't know. Colds followed by amenorrhea. So women not having their, they have a cold and then they don't have their period afterwards. That's what this would be good for. And gastroenteritis, which is, of course, stomach issues. And any suppressed colds, any colds that have been suppressed by drugs or whatever, you would use this to clear up any symptoms after that they were having. Okay, so milkweed, which is Asclepius cornuti, which is milkweed or silkweed. Okay, Asclepius cornuti is a remedy for dropsy. Dropsy is fluid retention. Hepatic is liver diseases, liver problems, or hepatic kidney or after scarlet fever. Now, scarlet fever comes from strep throat. You get strep throat, don't take care of it, you end up with scarlet fever. And that's what I thought might have been happening with my son because it leaves a skin rash. But here, he was scratched by a cat, and I totally forgot about that, and I couldn't figure it out. I'm thinking must have had strep throat because he said he had a cold. And see, I prejudged, and I went on what my son said. I think I got a cold, Dad. And I totally forgot that a week ago he got scratched by a cat, because he was trying to bathe it. So I'm shooting for a cold. And that's why I say if you're off the chief complaint, the center of gravity of where this came from, that etiology of being scratched by a cat I would have got a medicine easily. But I prejudged and said, oh, he's got a cold. Now, if I'd have took the case and said, what happened? Has anything happened recently? Nah, and this and that. Well, I got scratched by a cat, So anyways, whenever you are taking a case, you got to figure out where it came from. So I figured maybe he had, now he was having scarlet fever from having his, having like strep throat. He had strep throat, that cold he was saying he had. Week later, he's got a rash all over his body. That would tell me it's scarlet fever, unless, of course, you're scratched by a cat. Let's see, kidney scarlet fever. It causes diaphoresis, which is just sweating, and augments the urinary secretion. So it brings on a lot of urine. They start urinating a lot. They're sweating a lot. And that's probably with a cold, a fever, a bronchitis, whatever. Dropsy after heart disease. So that their fluid retention, they had heart problems, pleurisy, what is that called? Angina pectoris, whatever they had going on with the heart. Now they're retaining fluid. Uremia, intermittent pressing down in uterine pain. So that is, and like I said, there's not much here, but Asclepius cornuti, milkweed. Now, Asarum Canadense, wild ginger. They should have, it'd be nice to get that proven out to see what else it's good for. I'm wondering if there is regular ginger rather than just wild. I don't know. But Asclepius cornuti, milkweed, nervous system. So it affects the nervous system, the urinary organs, and it's good for influenza, bronchitis, hay fever. Another hay fever remedy, which I didn't add to my thing. The PDF that I have that has asthma, allergies, and all that I showed you. Where is that? That's over there. Um, it doesn't have this one on it. Yeah, I'm sure of that. But you know, it's a it's not a 3, so it's definitely can be used for hay fever if nothing else is working. But the main ones are on my PDF. So you got a main thing of a PDF that you can go in and look at asthma, allergies, whatever's going on there, and then you can go, there's another PDF that has all the medicines with some of the keynotes that you could, if you can match those keynotes with what's going on to the person, you most likely could clear up the hay fever. Now you can go get a combination remedy which has 20 of them in there, and it probably will work, but you don't know which one works. So if you're going to continue to try to work on this person and give them optimum health, then you'd want to know which medicine works so that the next phase you can say, yeah, this is what's going to come next. Once you peel that layer of that allergy off. Cutting and aching about lower dorsal vertebrae. So the vertebrae's got this cutting and aching pain in it. Female, intermittent bearing down, labor-like pains, pressing from sacrum to hypogastrium. So the back to the lower, the sides of the hypogastrium is the sides of the abdomen. Scanty flow, suppression of menses. So this could help bring on the menses to relieve the whatever's going on with them. Increased appetite, vomiting and headache with constipation. So this is the stomach stuff that's given the headache and vomiting going on. So that's why I always say some people have a gastric headache, which would be most likely in this case. Great appetite a few hours after a meal. So they, like it says, increased appetite. So they have an appetite, they go in and eat, and now the appetite's just as great even after they ate. So that could lead to obesity, I would imagine. Feels as if a sharp instrument were thrust through from temple to temple. So that's why when you say, what's your headache like? This is a gastric headache. What's your headache like? It feels like a sharp object thrust through a stabbing pain. If they said a stabbing pain, but if they came out, this is a 3. It feels like something's going, a sharp stabbing pain instrument going through from one temple to the other, which would be more like a forehead type of pain. Headache, nervous headache after suppressed perspiration. So they're, they need to sweat. That diaphoresis, the medical term. They need to sweat. They gotta sweat. You suppress the sweat by, a cold. And that's what I think. That's what's going on with everybody in my family. It's very hot out. We go out in the heat, we sweat, and then we come in and suppress the sweat by cold air condition. And everybody's getting sick. And I think that's where it's coming from. So any suppressed perspiration, they get the nervous headache also. Followed by increased urine with increase of specific gravity. So solids, less solids coming into it is what that means, that gravity. But they're increased urine whenever they have this headache from suppressed perspiration. So they get this headache, and that's a 3. Increased urine with increased specific gravity. So less solids are coming out, and the liquids, the urine is more clear and stuff. So that's a 3. So the temple thrust through and increased urine is a 3 with this one. Increased flow of urine, pale colored with light specific gravity, not a lot of solids in it. Increased, or it can have increased solid matter. This could be different stages of the sickness or whatever they got going on. Lungs, increase of bronchial secretion, so they got a lot of mucus. Burning and tickling in fauces. Now these are all the things that happened when they gave this medicine and the people would get this. So it would cure a lot of bronchial secretions, increased bronchial secretions. It would cure burning, tickling, and fauces. And there's no cough, it says. Pain in the left side of chest on deep inspiration, and this is from pleurisy. So, which is a lot of lung stuff with this, a lot of bronchial influenza, a lot of mucus secretions, a lot of urination, a lot of sweating, probably from a fever and that going on. They have a tickling sensation at end of penis. That's for the male, of course. Diarrhea with nausea and vomiting. So there's that gastric stuff, which is giving them the headache. With excoriation of anus. So they got, all this nausea, this vomiting, and this diarrhea, especially. Well, the diarrhea is given the excoriation of the anus, but there's a lot of stomach stuff going on. The stool is copious, soft, a copious soft stool, fluid consistence, yellowish. Okay, so it's fluid, that's that watery diarrhea. Consistent, it's a fluid consistency, so it's watery, sorry. Yellowish in color. So there's some yellow in there, and that can be the liver and kidney stuff coming, being, producing that, because you have that kidney and liver stuff going on. What is it? Oh, urinary influenza, urinary organs. Well, anyways, liver and kidney stuff you got going on. I think I read it. And attended with some gripping pain. So they got gripping pain, yellowish, watery, basically stool, and it can be soft, but it burns the excoriating the anus, and there's a lot of vomiting with it. Constipation. They can have constipation. Pain in right side of lower limbs from this constipation, I would imagine, and a loss of appetite instead of this great appetite. So there's different phases and different stages of these, of a sickness. It can either be that diarrhea or it could be constipation. Some alternate constipation with diarrhea. Drowsy. They're very drowsy, sleepy, hard sleep at night. So they knock out at night, and they're drowsy and sleepy most likely throughout the day. Excessive nausea with violent headache. So there's that gastric headache again. Violent, severe, long continued vomiting with retching, and a sensation of rawness in the stomach. So, that's why I always say, they got a headache. Oh, I get this headache, Now I'll start with, what's it feel like? Burning, stabbing, stinging, throbbing, pounding. And this would be more like the stabbing part. And depending on what they say, then I would have to consider where does it come from? Is it stress? Is it gastric stuff? Is it the wrong food? Do they have allergies? They have sinus stuff going on. So you have to sort of determine that. And this one with Asclepius, Cornuti, whatever it is, Asclepius anyways, would be a gastric headache. Temperature, coldness on the surface of the skin, and a feeble pulse. So it's not saying they have they have coldness of the skin, but it's not saying that they have a fever. There's no heat with that. Burning and tickling in fauces with nausea and headache. So there's that headache again with this burning and tickling in the throat. Tongue is covered with white fur. So that's the other end of it. You have them stick out their tongue. Now, why do you need to know the tongue? Why do you need to know where the headache's coming from? You are trying to you're differentiating between a few different medicines. So when you want to differentiate, that's what you got to look at. Some medicines, the tongue can be clear. Some medicines can be tongue furred in the middle and red edges and red tip. Some can be like yesterday's was cracked tongue. They could have cracks in their tongue, or fissures they call it. It could be strawberry colored. That could be like a belladonna situation. Because anyways, you look at the tongue, you look at the eyes, see what kind of stuff they got. Mucus coming out of it. They got this going on with it. The mouth, any ulcers, any cracks in the corners. What color's the skin? Do they have a bluing of the skin? Are they pale? Are they death-like? Do they have a yellowing about their skin? So there's, yeah, all these things come in to help you determine between one medicine and another, and to figure out where is this sickness coming from. And of course, you have to do the etiology, and the etiology is basically what happened. Like my son, I did not even consider a week or two ago, probably 2 weeks earlier, he was scratched by a cat. That gave him this bacterial infection that caused him to have, like, the body's trying to throw it out through his sinuses and his throat and all that. It wasn't a cold. It was a bacterial infection. Then all of a sudden he got this skin rash. So yeah, I could have took care of that so easily if I would have just took the case basically and said, what happened to you? When did this come on? When did this start? Was there anything that happened? And that always helps. Yeah, well, I got scratched by a cat, and he wouldn't think that's anything to do with a cold. That would have said, aha, now I know what's going on. So the Asclepius Cornuti seems to act especially on nervous systems, urinary organs, nervous headaches, as if a sharp instrument was thrust through, followed by sweating of profuse urine or profuse urination. So this is not the fever cold type of thing, I would imagine, because it's the urinary and the sweat coming on from vomiting, gastric stuff. There's a lot of gastric stuff. Belching of food with its proper taste. Now it's good for influenza, catarrhal fever. Now there is the fever, so there must be a fever here. These guys, they did the best they could with what they had, taking these cases, giving these medicines, getting the people together, taking their symptoms. So there is a catarrhal fever. Catarrhal is just a thick mucus that needs to come out, and they have a fever with it. Bronchitis, hay fever. So any kind of flus, colds, bronchitis, all that stuff. Headache from check sweat or retention of effete matters. Matters that are no longer useful is being retained in the body. They get a headache from that, or from not, from happening to sweat and not, stopping the sweating, whether through a shower or through cold fan or cold air. Uterine pains are intermittent. So they'll have a pain, go away, then a pain again later. So it's intermittent. Pressing with threatened miscarriage. So there's a pressing pain with threatened miscarriage. This could be one of the miscarriage remedies. Coldness of surface after vomiting. So they're vomiting and the skin's cold. So you always, with this medicine, there'll be cold skin. There's a couple medicines like that. Diaphoresis, which is sweating, profuse, and then they say right after profuse sweat. Okay, why use diaphoresis? Why not just profuse sweat? Acute rheumatism. So rheumatism that comes on wet weather, whatever, it's acute. It comes on, you have these pains and aches, it goes away. And confined to large joints. So it's not the fingers and the small joints, it's the knees, the elbows, the wrists, the joints, the big joints, with much pain and swelling. So a lot of pain and swelling with this one for rheumatism. So good for rheumatism, any kind of colds and flus, someone who's doing a lot of sweating and a lot of urinating. They have diarrhea, they have headaches from their the gastric stuff going on for them, and that headache is thrust through like a sharp object through the temple to temple. So like I said, bronchitis, influenza, hay fever. So that's, with our medicines, it's not like I got hay fever, you got to take Benadryl or something. That'll take care of it every time. Ours is, you have hay fever. It could be this, it could be 5 different medicines. Now I have to figure out which one it is for you, because we're all individuals, and of course belladonna will only, stop the symptoms. It won't clear it up and take it away, where your vitality. And I was telling a kid yesterday, I did an interview for the mastermind that I was in, and I was telling him, the medicine isn't what cures you. What cures you is that medicine coming in, and your body rises up, fights the symptoms, your immune system, your we call it the vital force. The prana is Indian, and chi is Chinese. So it rises up to fight what I put in you and clears up the symptoms. Why do we know it works? Because people have basically taken it until they got the symptoms, basically until they were poisoned. Now they got the symptoms and they were poisoned by it, and they wrote it all down. So now you see them symptoms in a person, like cures like, you see them same symptoms in a person, whether it's bronchitis, influenza, headache, hay fever, gastric stuff going on, diarrhea, constipation, whatever's going on with that person. You match those symptoms to this, and what it really helps is going through and using the repertoire. And the medical repertory, that basically gives you all, say you got a cough. Is it a hacking cough? Is it a hoarse? Are they hoarse from the cough, which my mother was just going through? Hard inspiration aggravates the cough. Is it intermittent? So there's all these things. So you go under a cough, which is the big one, and then you go under these other categories, what's going on with that person. And as you go under those categories, you will get medicines. So let's say the hoarseness, like I was doing for my mom. I had aconite, allium cepa, belladonna, bromidum, carboveg, causticum, drosera, hepersulf, Calibix, Spongia, and Stana metallicum. Those are the big ones. Now, Russ Tonks, Rumex, those ones are small, like a 2. These ones, the bold, big print, is a 3. These are a 2, and like Sabadelia right here is a 1. So it's not as, in this coughing with hoarseness, it's not as, so you can see the trouble that you can have with homeopathic medicine. You got so many medicines that you, just for coughing with hoarseness, now you have to determine between them by differentiating, what is your cough like? This one doesn't have a cough. Lungs, bronchial secretions. Is there a lot of secretions coming out of the bronchi? So now you got to determine that. So that can be a bit tricky, but it also can be very easy by knowing keynotes, knowing what happened, what brought it on, knowing their history of, does their family always get this, and then once you narrow it down to a couple different medicines, then you'd go and ask some questions to differentiate. This cough, does your throat hurt? One of them may have pain in the throat, one will be no pain in the throat. Or does it feel raw? One will be raw, the other ones won't. So this is what you're doing. You're trying to figure out and differentiate between one to another through the symptoms you got off that person. So the thing of it is, though, is this medicine really works, and it can work to an effect where you no longer have the problems. Do you have to be a homeopath to do it? No. Do you have to have all this medical knowledge? No. You basically have Google. I Google a lot of these terms, diaphoresis. Oh, sweating. Yeah, they don't, I don't know. But anyways, all these terms are used that, I just Google, and I didn't need to know that. That was sweating. Sweating was already in the instruments that I had, in the materia medica that I was looking at. So, yeah, you basically just go in, you look up the medicines. First, you take the case. You say, what's going on? What's wrong? What happened? Why did it happen? Has this happened before? Is this, what else goes? Is there anything connected to it? So it's clams, concomitant. Okay, with this headache, what else you got going on? Oh, my stomach, I got diarrhea and vomiting. Okay, there's a concomitant. You've got stomach issues going along with your headache. Location, where's it at? Oh, it's in my temple, to my temple. Okay. Etiology, what makes it come on? Well, I eat these certain foods and I get, I get stomach problems, and I get diarrhea, whatever. Then I get this headache, so now we know you eat certain foods, you get a headache. You know, you can always cut out the foods, or this medicine can help you to tolerate them. Etiology, and then M is modalities. What makes it feel better? What makes it feel worse? Is it better by lying down? Is it better by standing up? Is your headache better by pressure? Is it better by cold? Is it, you know, so what makes it feel better and what makes it feel worse? When I sit up, it makes it worse. When I eat certain foods, it's worse. When I, you know, so the modality, then the sensation. What's it feel like? Well, it feels like a sharp instrument's being thrust through from temple to temple, or your bronchial, you know. So I'm not going to go deeper into like bronchial. So the bronchial, what color's your mucus? You know, now this doesn't have any color mucus, or, you know, then they have color in the diarrhea, yellowish. So you want to go by color. Is it thick? Is it thin? Is it, you know, how's the headache? Is it throbbing, pounding, you know, all that kind of stuff. So that's why, like I said, Hahnemann, you know, these doctors that were using allopathic stuff like mercury and bleeding and different things at that time, which we think is so barbaric. But now we're a lot better. We irradiate you, your hair falls out. We give you poisons that you'll have side effects from. So we've grown a lot. But homeopathic medicine, they seen how it worked. Whoa, that does work amazingly good. So they seen how it worked, and they started utilizing it, but they realized, wow, this is a lot harder. Someone has this symptom, I just bleed them. You know, I don't have to think about medicines and try to find the medicine and try to, you know, I don't have to mess around a lot. I just give this thing and it fixes it for that moment. And then, you know, usually they're stuck on mercury forever, or they got to come and get bled every so often, because otherwise this thing keeps happening. Where they were seeing that homeopathic medicine cleared it up. Whoa, that worked, and this person doesn't have that problem anymore. So they started utilizing it, but then they started mixing them, because homeopathic medicine, I can't find the right medicine. And you'll see with some of these guys, they were doing like 5 medicines and they couldn't find it until they got to one like a small Asclepius or Asarum that, you know, was a medicine that would work. But they tried all the usual ones and they couldn't find it, and then used one like Asclepius, and it cleared it up. So they're like, you know, a lot of them weren't waiting for that. And he called them names. You know, they were just like, or they would just quit using homeopathic, and they'd give it a bad name and they'd go back to what they were doing, poisoning people and stuff. But the ones that stuck it out, they would use 5 different remedies, trying to figure this out, what's going on, and they would get the right remedy. I'm going through that with my mom. I'm giving her a couple different remedies, and that hoarseness I can't get rid of. Now, there's a periodicity. Same time last year she got this. Now, I'm starting to think, you know, this whole suppressed sweat, because they go out, we're sweating, we come in, we get under the air conditioning, we cools off, suppresses the sweat, and now we get sick. So I may have to go that way. So it can be a lot tougher. You know, it can be a lot tougher, but it's very effective and it's permanent. It's not like, you know, next year she'll have that same thing, you know. So I'm going to mention that to her, though. But getting hot, getting, you know, sweating out there, and then coming into the cold air conditioning, cooling off, and then that probably, and it's only happening at the end of summer. So the beginning of summer, you know, there's not as much air condition, it's not as hot. Then in the middle of summer, it gets real hot, and yeah, it's usually around a midsummer to late summer where it gets really hot. We go out, we sweat, we come in, we get sick. So I'm pretty sure that suppressed sweat is what's going on. Now I look under my books, just like this says, from suppressed sweat. Where the heck was that? Surfaces feeble, coldness, excessive. There's something in here. Suppressed perspiration. There it is. Headache from suppressed perspiration. So I would be looking up colds, flus, and then I would look under suppressed sweat. So, all right, that's morning medicine. You can age, but you don't have to get old. I think I'm doing snake root tomorrow. One guy, he said, what are you doing herbs with people? No, just we use plants. We use arsenic. We use belladonna, which is deadly nightshade. We use a lot of different things, and I just like to bring the plant in to show, hey, the herbalist has been using this for years. Now it's good for, and that's, milkweed was good for mucus stuff. And we use it homeopathically for mucus stuff. So, all right, that's morning medicine. You can age, but you don't have to get old. Made it on time, baby.